Welcome to this educational video about bladder neck obstruction, a condition that can significantly impact a person's quality of life. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. Understanding this condition is crucial for early detection and effective management. So, what exactly causes bladder neck obstruction? The primary culprit is the overgrowth of smooth muscle fibers at the bladder neck itself, often associated with benign prostatic hyperplasia or BPH in men. This enlargement narrows the opening of the bladder, making it difficult for urine to flow freely. In women, it's less common but can arise from scarring after surgery or injury, or sometimes even without a clear cause, which is termed idiopathic bladder neck obstruction. Neurological conditions and certain medications can also contribute to this condition by affecting bladder muscle function. Now, let's dive into the pathophysiology. Imagine a dam blocking a river. Similarly, bladder neck obstruction restricts the outflow of urine. This leads to increased pressure within the bladder, causing the bladder muscle, called the detrusor muscle, to work harder to push urine through the narrowed opening. Over time, this constant strain can thicken the bladder wall, reducing its ability to contract efficiently. This weakening can eventually lead to incomplete bladder emptying and a host of related symptoms. In severe cases, the back pressure can even affect the kidneys, potentially leading to kidney damage. While bladder neck obstruction most commonly affects older men due to its association with BPH, it's important to understand its prevalence. Studies indicate that a significant percentage of men over 50 experience symptoms related to BPH, and a portion of those men may develop bladder neck obstruction. In women, the condition is much less common, but the exact epidemiological data is limited due to the variety of potential causes and diagnostic challenges. It's a condition that can affect individuals of different ages and backgrounds, underscoring the importance of awareness. Recognizing the signs and symptoms is key to early diagnosis. Common symptoms include a weak urine stream, hesitancy or difficulty starting urination, straining to urinate, a feeling of incomplete bladder emptying, frequent urination, especially at night, also known as nocturia, and urgency, the sudden and compelling need to urinate. In some cases, patients may experience urinary retention, meaning they're completely unable to urinate. The severity of symptoms can vary greatly from person to person. Diagnosing bladder neck obstruction typically involves a thorough medical history and physical examination. The doctor may perform a digital rectal exam in men to assess the size and consistency of the prostate. Urine tests can rule out infection or other underlying conditions. A post-void residual volume measurement, usually done with ultrasound, assesses how much urine remains in the bladder after urination. Uroflowmetry, which measures the rate and volume of urination, is crucial. Cystoscopy, procedure where a small camera is inserted into the bladder, allows direct visualization of the bladder neck and urethra. Aerodynamic studies can further evaluate bladder function and identify the presence and severity of the obstruction. While bladder neck obstruction doesn't have strict classifications like some other diseases, it can be broadly categorized based on its etiology. We differentiate between obstruction primarily caused by BPH, obstruction due to scarring or strictures, and idiopathic bladder neck obstruction, where no clear underlying cause is identified. Understanding the specific cause helps guide the most appropriate treatment approach. Treatment and management options vary depending on the severity of the symptoms and the underlying cause. Mild cases may be managed with watchful waiting and lifestyle modifications like reducing caffeine and alcohol intake. Medications such as alpha blockers can help relax the smooth muscle at the bladder neck, improving urine flow. Alpha reductase inhibitors can shrink the prostate in men with BPH. More severe cases may require surgical intervention. Options include transurethral resection of the prostate or TIRP, bladder neck incision, or other minimally invasive procedures. The goal of treatment is to relieve the obstruction and improve urinary symptoms, enhancing the patient's quality of life. Preventing bladder neck obstruction can be challenging, especially when it's related to age-related changes like BPH. However, maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate hydration, can support overall urinary health. For men, early detection and management of BPH can potentially reduce the risk of developing significant bladder neck obstruction. Regular check-ups with a healthcare provider are essential for monitoring urinary health, especially as you age. The prognosis for bladder neck obstruction is generally good with appropriate treatment. Most patients experience significant improvement in their symptoms and quality of life following medication or surgery. However, untreated bladder neck obstruction can lead to complications such as urinary retention, urinary tract infections, and even kidney damage. Recent research focuses on developing less invasive surgical techniques and refining medication therapies to minimize side effects and improve long-term outcomes. Researchers are also exploring the role of lifestyle interventions and alternative therapies in managing the symptoms of BPH and bladder neck obstruction.